If you've been hesitant about consuming more protein in your diet because you're worried about kidney disease or cardiovascular disease or other diseases, then you're probably going to want to stick around today because I've got some new information that I want to share with you that really shines a new light on how we should be thinking about high protein intake and in reality what it's doing to the human body. Hey guys, I'm Dr. Arland Hill out at Harvest Hills Ranch, and I want to share with you today some information, a study that came across my face that I thought, man, I've got to shoot a video on this, and I've got to get this information out there to my listeners to let you guys take a look at what's actually the reality of consuming higher protein. And today I'm going to focus specifically on kidney disease and if there's any real concerns around getting those protein intakes up. And we're going to talk about some levels here today of what classifies as a higher protein intake and what we're actually trying to accomplish in doing that. And what is the actual impact on the kidneys? And then I'm also going to speak a little bit here about what are you likely to see on a lab. So if you're looking at trying to optimize your health, you're probably looking at labs, having conversations with your doctors or medical clinicians, and you're getting feedback on them. So when you guys are looking at that together, I want you to have some realistic expectations about what you may be seeing and also give you an idea of this is not necessarily a problem. This is just a natural byproduct of increasing protein consumption in my diet. With that all being said, let me share with you what came across, and it's a study out of the European Journal of Nutrition, so current year here. And you'll notice on this, it's protein intake and risk of urolithiasis and kidney diseases. So we're talking about kidney stones here is what we're specifically focusing on. And kidney stones are certainly a consideration, right? I mean, fortunately, I've never had one, but certainly in talking to individuals that have, very painful. Definitely don't want to go through that. And if there's things that you can do to modify your diet to prevent the recurrence of that, or even better, prevent it in the first place, then hey, all the better. Let's make that happen. And so a couple of things here in looking at higher protein intake. And I want to make mention that the information that we're looking at here, this is a systemic review. So this was pulling in a couple of randomized controlled trials and reviewing those and getting feedback and trying to establish a level of confidence based on that information. So let me share with you a few things here that stood out to me as I went through this information. So first of all, if we look at what the actual risk factors, the true definable risk factors for chronic kidney disease, you'll note that very blatantly it's stated here that chronic kidney disease, your major risk factors are going to be hypertension, hyperglycemia, and obesity. Now, is diet a factor in that? Hands down, yes, diet is a factor in that. But when you look at any one particular, whether it's macronutrient, micronutrient, so if we're talking proteins, fats, and carbs, or we're talking vitamins, minerals, not one specific one of those is implicated in hypertension or in hyperglycemia, in some of these other conditions. So for example, the obesity, right? It's not necessarily the intake of each one of those. It's the pattern of the diet that really makes the difference. And I don't think I really have to beat this point, but obviously we know if someone has a poor dietary pattern, you're more likely to develop hyperglycemia. You're more likely to have a pattern towards obesity. And as a result of that, you're probably going to see changes in your blood pressure. So it's not directly, when we talk about a high protein intake, we can already see implications from just what's being stated here early on that it's not going to be linked to chronic kidney disease from higher protein intake. Okay, so that's the first thing that stood out to me on this. Now, I think what we have to talk about at this point is what is a high protein diet? What is a high protein intake? Let me say it that way. And if you look at what has been considered baseline for protein intake, it's considered to be 0.8 grams per kilogram of body weight. And what is that number actually telling us? Well, what that number is telling us is that it's keeping you in what's known as a positive nitrogen balance. That number is not directly reflecting what is maybe considered to be an optimal protein intake or a protein intake that is going to whether it's stimulate recovery, regeneration, whether it is to optimize From proteins, you are going to produce amino acids, and if you deliver those amino acids to the nervous system and produce neurotransmitters from those, just as one example. There's many different types of examples we could talk about here. Muscle synthesis as another example on that, right? So all the things that the dietary protein intake can help us optimize. The point is that we're talking about a level that really starts to climb well above 1.8 grams per kilogram of body weight. In some of the literature I've reviewed on this, we see numbers that go up to 2.2 grams per kilogram of body weight, which would be stated differently as 1 gram per pound of body weight. And those have been considered to be very safe levels. I've even seen some studies that reference all the way up to 3 grams per kilogram of body weight as being safe and ideal as well. So there's a fairly large range that we're talking about here. And I'll share with you that even in this study, we see that one of the groups that was assessed here was all the way up to 3.3 grams per pound of body weight per day. So many would look at this and say, wow, that's an exceptionally high amount of protein, but it's all contextual. It's all about how are you using the protein? What are you trying to accomplish? What are you doing with other macronutrients in your diet, like carbohydrates and fats? And so all of those things start to play a role here. What I'd like to do is show you specifically, if you're looking to increase your protein intake or you have a high dietary protein intake already, what are some things that you might anticipate to see by that? So let me share with you what are some things that you might see here. And one of the ones that many individuals will focus on is the glomerular filtration rate. And if that glomerular filtration rate, GFR, we'll just state it as GFHR from here, GFR from here. If that starts to decline, then that's implicating that you're going to have decreased functionality of the kidneys. But notice on this that you see what I have highlighted, that increased body fatness, obesity also lead to elevations in GFR, independent of hyperglycemia and other metabolic and hormonal signals also present in diabetes. And one of the things that stood out to me that was highlighted through this study is that the glomerular filtration rate can fluctuate temporally. And so what that means is that you may consume a high protein diet, you may see what would be in the short run interpreted as a negative trend in GFR, only to come back and reassess that, say within 12 hours plus, what's often utilized as a fasting time frame, and realize that GFR is completely normal. And so there's a time frame of when you had that protein in regards to what the impact potentially is on GFR. And some might look at that and go, well, doesn't that mean that over time there's going to be a negative impact on that? No, it doesn't. That would be akin to saying that if you consume carbohydrates and you have a rise in insulin temporarily, that short-term rise in insulin is problematic. And I would actually argue opposite to that there are some beneficial aspects to insulin, even just beyond blood sugar control here. And so with that in mind, we have to look at things as happening over a short time frame after a dietary intake, whether it's protein, as our core topic is here today, or whether it's related to carbohydrates and insulin. What's happening short term after that food intake versus what's happening over a sustained time frame, those two are very much different. And you can see the last statement here says, in line herewith, none of this systemic reviews of this umbrella review found clear indications for GFR reduction due to high protein intake. And so we just can't, based on this information, align the protein intake with affecting GFR specifically. Now, something else I want to come to on this, one of the things that we hear oftentimes is about acidity of urine and food intake. And this is where I want to bring into the conversation the type of protein that you're consuming and making sure that that's a nutrient-dense protein. Looking at some of these alkalinizing aspects, they talk about a high protein intake could potentially drive up or could potentially increase the acidity, not drive up, but actually decrease the pH and increase the acidity. But what you have to look at with that is that there's a counter to that with the consumption of fruits and vegetables. And so if you have an omnivore pattern in your diet where you're consuming meats and plants, this is probably a bit of a moot point. But nonetheless, if you have a diet that trends more towards higher protein and you're making that a preference in your diet, the source of these foods really begins to matter. And the reason is because of nutrient density. And so, for example, if you have a more nutrient dense, free range, for example, source of food. So let's just talk about beef. Let's say you've got an appropriately raised animal. That beef is going to have higher amounts of minerals in it. Likely there's going to be higher levels of other nutrients in there based on some of the data that's coming out, looking at grass-fed versus non-grass-fed, grass-fed and finished animals versus feedlot animals. And then also we know that the phytonutrients are going to accumulate in that meat as well. So you can get some of these same nutrients that likely yield the buffering effect of fruits and vegetables from meat sources, just assuming that you're consuming the appropriate sources of those meats as well. There was one other that I wanted to point to in here, which was uric acid. And that's another one that you'll often see. And this one follows the same guideline, which is that increases in urea, mostly within normal physiological range, have been reported in almost all primary studies after protein intake was raised. So bottom line on this is that if you are consuming protein, you should expect some degree of elevation in your uric acid. Does that mean that it's problematic? Likely no. According to this, there just doesn't seem to be a problem with that. But again, you have to think big picture on this too. If you have an overall poor dietary pattern, more of a Western standard American diet type of pattern, yeah, you may need to be a little more conscientious about that uric acid and not necessarily throw caution to the wind with just consuming a bunch of protein. It really does matter in total what your food consumption is. But nonetheless, I don't want you to be alarmed that if you see a reduction in GFR, if you see that your uric acid levels are increasing, if you see that your urinary pH is changing, then these are things that are normally associated with changes in diet that are linked to high protein intake. So just be aware of that. Now, in conclusion, I want to point out here two statements: that none of the outcomes was a convincing certainty of the evidence found for detrimental effects of high protein intake with regard to development of kidney disease. So just to state that a little bit clearer in everyday language, you're not going to be at risk for developing kidney disease just as a byproduct of consuming higher protein in your diet. That just the literature just doesn't support that. So it's not something that we should be worried about. And even in individuals where we might worry about this, that do have renal dysfunction or kidney dysfunction of a more pronounced nature, we can see that the higher protein intake is not going to push you in that direction. But what if you're already there? Well, you need to be a bit more conscientious about what you're consuming, certainly at that point. But we also see that in these individuals, that higher protein is being shown in the studies. And let me state that a little bit differently. What we're seeing in the studies is that the protein intake doesn't have to be as low as what we have previously considered with even those groups of individuals. Now, admittedly, I don't do any significant work with individuals with chronic renal disease. That's not within my wheelhouse, so I'd rather other individuals deal with those folks. So I'm just telling you what's based in the literature and not what my personal observation has been in that particular arena. The other statement that I wanted to share with you here is because I did mention kidney stones. You can see the rating of overall certainty of evidence revealed no relationship between protein intake and the risk of incidence of nephrolithiasis, which is your kidney stones. And so you're not going to see a correlation there, which means that there's other factors in the diet that are playing a role beyond protein intake. So I found all this stuff interesting. I felt like it certainly was important to share this with you because it's a change in what we often hear. Oh, you eat more protein, it's gonna cause you kidney problems in the long term. And granted, we do need more information over a much longer time frame, but certainly the data over the time frames that we have is not pointing in that direction at all. In fact, if we look at the conditions that are typically geared towards chronic kidney disease, or do push individuals towards chronic kidney disease, the hypertension, hyperglycemia, obesity type profile. We find that higher protein intake for most of those patients actually benefits them and begins to improve those states of metabolic dysfunction. So I thought I'd leave you with that information today, guys. If you like the information, hit that subscribe button. Come on back. I'll continue to share stuff like this with you, and we'll talk about the impact that the foods that we raise here on the farm can have and how they can help optimize your health as well. So with that being said, I'll talk to you soon. I'm Dr. Arland Hill out at Harvest Hills Ranch.